Hi, welcome to a brief webinar about autism, what it is, and what signs to look for. Hi, my name is Julie Aiello, and I am a board-certified behavior analyst who works with kids in a play-based clinic setting. I also work with schools to provide training and consultations, and I also work closely with families near and far, providing virtual parent coaching services for some of those bigger behavioral issues that can pop up here and there. So a little bit about me. I have a master's degree in special education with an emphasis on intensive special needs, and I am also a BCBA, as I said. I have spent the last 20 plus years working with kids with challenging behaviors in a variety of settings: public schools, therapeutic day schools, residential schools, clinics, in homes. I have worked with kids with varying diagnoses, including autism, sometimes with no diagnosis at all. My goal in whatever I'm doing is to help the kids be successful in whatever it is that they are struggling with. Today, I just want to talk briefly about the early signs of autism, what developmental trajectory kids should be on, what parents can look for, and what to do if you do notice some of the signs in your own child. So let's start off now by talking about what autism really is. So what is autism? I'm not going to spend a lot of time on this, but just as a brief overview of kind of the diagnosis piece. Autism is what's known as a spectrum disorder, which means that there are certain criteria that someone has to display in order to get that diagnosis, but those specific criteria have to fall under a pretty wide range, making it a spectrum. And on top of that, certain things within it need to coexist at the same time. So according to the DSM-5, which is the most recent diagnostic manual that really outlines all of the current diagnoses that are out there, in order to be given a diagnosis of an autism spectrum disorder, a person needs to officially meet this, albeit quite wordy, criteria. I'm not going to go over this in depth with you, but it's just important to know that there are a lot of pieces that have to fit in order for that diagnosis to be given. And it's hard sometimes to tell what is an actual symptom of potentially of autism and what is not when you have a young, still developing child, right? So what is it that you actually should be looking for? About development now. After that brief overview on what the diagnosis of autism actually means. Let's talk about typical development. As your child develops, they gain more and more skills over a pretty short period of time. So from 0 to 5 in particular, they gain a ton of skills, and it's really not a long range that they develop this in. But how do you as the parent actually know what is in the range of typical development and what is actually a cause of concern for you? First of all, your pediatrician should be having you fill out forms periodically at some of your child's well visits, so when you go for your checkups. Usually you will be given something called an MCHAT or M-CHAT at some point. This form is just a rating scale and allows your doctor to identify if there might be some other areas that would warrant further evaluation at that time. But regardless of whether or not you're completing this form, you are with your child a lot. You're the expert on your own kid. I can't say that enough. Babysitters, daycare providers, family members, they might mention some things to you, but if they aren't super obvious, they might not pick up on them. What should you do, though, if you have concerns or you hear concerns coming to you a lot? We're going to start with just a basic education as to what the realistic milestones for each age range actually are. So the CDC has some basic guidelines for what to expect around each age. You can find some more comprehensive information about this because I'm going to go through it with some bullet points. But if you want more information, the website is on the bottom of this slide, and it's also available on our YouTube page. When my kids were younger, there were also lots of apps. I'm sure there's even more now that will tell you when your child is 2 months, 4 months, 6 months, what are some milestones that you should probably be seeing. A lot of parents follow those as well, and they're based on the CDC guidelines. So let's start when they're really little. So 2 months. At 2 months, babies are often calmed by being picked up. They often watch your face as you approach them and start to make some sounds other than crying. And they also start to develop a startle reflex. They can get startled at loud noises. They might jump if something happens really loudly. When they turn 4 months, they start to do things like smiling on their own, which is fun. They start to move their body or make some noises to try to get your attention. They might start making sounds back to you when you talk to them, which is really cool. So that reciprocity of conversation and communication is starting to develop. They will turn their heads towards you when they hear your voice. And something else they do right around this age that they might not have done before is that they will open their mouth when they see food sources approaching. And what I mean by that is before 4 months, even if you knew your child was hungry, if you were approaching them with a bottle, you might have to nudge their lip to get them to open their mouth. I know I had to do that with my kids. And when they get to around 4 months, you don't need to do that anymore. They start to open their mouth on their own. And another thing they do around 4 months is they start to notice that they have hands. So if you've ever been around a 4-month-old or around a 4-month-old, they are often mesmerized by these hands that seem to be moving independent of their body, right? So they're starting to watch them and they're starting to move them around, and they might use them to swing at toys or things like that. They're not really using them functionally yet. They're just starting to recognize that they have appendages that do things, right? But they're starting to pay attention to them. When they get to 6 months, this is where you see babies start to look at themselves in the mirror a lot. You'll notice a lot of baby toys have little mirrors on them, play mats and things like that. And those are the type of toys that become more commonly used right around the time that kids are 6 months. They start to get more interested in them. So they'll look at themselves in the mirror. They'll take turns making sounds with you too. So again, that reciprocity of communication is developing. They might blow raspberries or squeal in response to things that you're saying or doing, or for fun, right? So you're starting to see more language starting to develop without the actual language being there yet that we know of as words. They, again, will be moving their hands to swing at toys. They're trying to kind of get them. They might try to reach for toys that are within their basic geographic area. They will put everything in their mouth. So if you know a baby, you know they like to put everything in their mouth. This really starts to become more prevalent around 6 months. And they're not doing that to eat. They're doing that to explore. So it's one way that they can explore things in their environment. And something else that happens around 6 months is that they start to close their lips when they don't want any more food. So if you're approaching with a bottle at 6 months, they might go like that, or start turning their heads, telling you they don't want it. So they're communicating with you. Around 9 months, you start to see some shyness around strangers. So before this, you might have been able to say, here, just hold the baby for a second so I can get something out of the bag to someone they don't know as well. Around 9 months, babies start to not like that. They get a little bit clingier. Totally normal around that month. They're starting to become more aware. They also start to develop some facial expressions that might match their emotions a little bit more accurately. They'll look around when you call their name. They might cry when you leave the room. They also are starting to make some more distinct sounds, which is kind of cool. Something else they start to do is to lift their arms when they want to be picked up. This is a huge one as well. They're communicating that they want something. They're not super mobile at 9 months, a little bit, but not super. And if they want you to pick them up, either to be held or to take them somewhere, they will tell you by putting their arms up and maybe making some sounds. Another thing that is fun at this age is that they have developed object permanence. So now peekaboo becomes really fun because they're starting to look for things that are out of sight that they might not have looked for before. At 1 year, they're able to say things typically like mama or dada or whatever they're calling parents. They're able to play some basic games with you, like back and forth games. Again, that like social reciprocity, basic ones, pat a cake, that kind of thing. They also start to develop an understanding of the word no. Does not mean that they like it and or listen, but you know that they understand it because you might say no to something and they might turn to you and then continue doing it while laughing, or they might stop what they're doing. You never know. They can wave to you. They can put things in a cup, so they're able to like recognize space. And there's some spatial relation things going on. They can start to pull themselves up to walk if they haven't done that already. They also can start to use one hand to pick up small pieces of food and move it. And then we get to 15 months, and at this point, this is when they start to imitate other kids. And I can't stress this one enough. Imitation's really big. So if your kid's not around any other kids ever, they might not be picking up on some skills that other 15-month-olds might be picking up on. And that's okay, but just know that because at 15 months old, they start imitating. And I always tell parents when we are working on imitation skills, if I work with a child who doesn't have that skill, usually older, and they say, why are we working on imitation? What is that going to do? And I always give them the analogy of imagine you're in a foreign country and you need to get on a bus and you don't speak the language and you don't have Google Translate in your pocket and you don't read the language and you're not sure if you need a bus card or a pass or if they take money or whatever the case may be. So when the bus comes that you know you need to get on, you will let people go in front of you, even if you were first in line, to see what they do so that you can copy what they're doing. And we do stuff like that all the time, right? You might be at the cashier at the grocery store and you notice that some people have walked up to the line and the card readers are working, so they had to do something different. Or when we're driving, we see what other people are doing and copy them. Maybe they know something we don't know. We're imitating other people. It's a way that we learn and explore and navigate our environment. So it's a big skill that you'll use for your entire life. And it starts around 15 months. Something else that kids do around this age is they start to clap when they're excited, right? Again, they don't have a lot of words. They're not going to have a conversation with you. They can't get up and jump. Usually at 15 months, they're not quite there yet with their motor skills. So they clap. They get really excited like that. Something else they do, which is cool, is they might start to share something with you that they like, which is really big because they're saying, I really like this. I'm going to give it to my mom, right? Which is a really good social skill. They start to say more words and also word approximation. So it could be a mix of words that you know. It could be a mix of approximations. Some kids are going to have more approximations. Some kids will have more words. Either one is okay. An approximation would be if I'm picking up that ball, I might say ba instead of ball because I don't have the full word yet, and that's fine. And lastly, they also try to start to use toys the right way. So maybe they had a toy cell phone that had fun buttons to press and it lit up and it made noise and there was a little mirror on it and they can watch themselves. Now they might also pick it up and pretend to make a phone call because they've seen you do that. Then we get to 18 months. And at 18 months, we start to see babies getting braver. They start to move further away from their caregivers on purpose. They do look back to make sure that you're still there. They'll also point to things they like to show you. So they're sharing their interests with you. They start to help getting dressed by putting their arms and legs or feet in wherever it needs to go. Some kids, I always say, my son, it was like always like trying to dress an octopus. It was really difficult. He was always just excited to go do the next thing. But you do see kids get more helpful at this age. They can follow one-step directions a little bit better. And they can copy you doing chores, which is cool. So they might want to help you sweep or something along those lines. And they also will start to play with toys the right way. So maybe they'll start pushing a car around instead of spinning the wheels. And then when we get to 2 years, children at this age do start to notice when someone else is hurt or upset. They might watch them. They might watch your face to see how you might be reacting to something. They can typically make 2-word combinations at this point, such as more milk, please. They can point to something in a book when they're asked, and they can point to body parts when asked. So if you're reading a zoo book or a farm book, you might say, hey, show me where the cow is, and they can point to the cow. Or you might say, touch your head, and they might touch their head. They're also getting to the point where they're better able at using 2 hands together. So instead of just being able to pinch something and put it in, which they developed a little while ago, now they can use 2 hands. One hand can hold whatever it is. The other hand can take a lid off or put a lid on, that kind of thing. So you're starting to see that cross body awareness, that motor planning piece is getting more advanced as well. Then we get to 2.5 years. So about 30 months or so. This is where we start to see more parallel play. Parallel play becomes more common around this age where kids start to seem like they're aware of each other. They're not necessarily interacting, but they might be doing similar things in a similar space. They also will start calling to you, hey mom, look at me, look what I can do. And they also can follow some pretty basic routines. This is really important at this age to remember to have some good routines. Try to keep things structured for your kids, because if you have a morning routine, a breakfast routine, if you have a getting ready for school routine, a bath time routine, a bedtime routine, a cleanup routine, kids are more likely to be able to participate and be cooperative in these moments. You can use songs. That's why schools use things like the cleanup song, because it helps kids to know what to do once they learn the rules of cleaning up. And having those basic routines at this age are really effective, and then getting older so that kids know what the expectations are and they can participate. At this age range, kids typically have about 50 words in their repertoire. They might have more. Some kids might have less. That's okay. Them having less words is not the only red flag. Sometimes they'll get more later. But the other thing that's kind of cool at this age is before you would say things to them like, hey, where's the cow in the book? Now you can point to the cow and say, what is this again? And they can tell you. So that's an advanced skill for them. And then by the time they hit the age of 3, they can calm themselves down, so they can self-soothe themselves within 10 minutes of you leaving them. So for those of you who have to take your child to daycare or to preschool, and you notice that your child has a hard time sometimes when you drop them off, I feel you. We've all been there. It's tough. But the longer you stay, the longer they'll be upset, because they are getting to the point where they can kind of self-soothe themselves within 10 minutes. This is a pretty average range. They do notice other children as well at 3 years. And now what you're starting to see is that if Johnny and Billy are both playing blocks, instead of building 2 things next to each other, they're now doing it together. They're interacting, and they might be building 1 thing together. So they're starting to engage more in play. They can engage in some back and forth conversation exchanges, limited, of course. They're only 3. And they can answer some basic questions. What's your name? Where do you go to school? What's your favorite color? And they, like I said, they can say their name. The other thing to note at 3 years is typically at this point in time, most of their speech is intelligible most of the time. So it is possible if you have a child where they don't have a lot of words or their speech is unintelligible to most people, it's not necessarily a sign of autism, but might be a red flag if that's the only issue that you're seeing to go get a speech and language evaluation. Oh, and they can label actions as well. At age 4, they engage in pretend play. So this is a big one too. You start to see your pre-Kers really engaging in pretend play. They play house, they play veterinarian, they play teacher, that kind of stuff. They request play when they know that it's available. So if you're walking by the park and they see their friend, they might say, "Can I go play with Maya?" They'll comfort others in distress. So before, they were recognizing kids were in distress or other people were in distress and they were watching. Now they might go and try to comfort you. They might bring you a Band-Aid. They might come give you a hug, whatever the case may be. Kids at this age usually avoid known danger. So if they know they're not supposed to go on the street, they will try to avoid it. If they know they're not supposed to go near the stove, they'll probably avoid it. I will say my son knows those things and he does avoid those things, but then he does other things like climb really high trees and things like that. But again, he's a little bit of a danger seeker. So those kinds of things are okay. And again, they usually avoid known danger as well as this being kind of a range, right? We have to remember that. Kids this age also enjoy helping. They want to be involved. They want to help cook dinner. They want to help clean up. Which is great. Doesn't last. I have older kids now and they don't want to clean, but that's okay. Something else at 4 years that's kind of cool is that they're pretty good at this point about being able to usually adjust their behavior based on the setting they're in. So if they're at school, they know what the rules and expectations are and they adjust their behavior for school. If they're home, things are a little bit looser. They tend to adjust their behavior for there versus the playground where it's like no rules. Let's just run around and scream our heads off and get all of our energy out. Versus someplace like maybe like church, if you go to mass, you might see kids at 4 they're not necessarily just sitting quietly, but they're behaving in a way that they wouldn't behave necessarily like on the playground, which is nice. They're starting to pick up on those environmental cues. They can also tell you about their day, which is fun. How was school today? What'd you do? What'd you make? What'd you eat? And then when they get to 5, at this point, these are our kindergartners. They can usually follow some rules and or take turns in games with other kids. They can answer simple questions after being read a story, which is a big thing. So they're hearing verbal information, they're able to hold on to it, and they're able to spit it back out when asked. They can keep a conversation going through 3 to 4 exchanges, which is really good. At this age, they can usually count at least to 10. They can usually identify their letters. And they can pay attention to things for 10 to 15 minutes at a time. The caveat to this is that this does not include screen time. So please remember that. Most kids can attend to screens for a long time, no matter what their age, it seems. But that is not a skill that's a typical development. Typical development is that children can pay attention to tasks, lessons, activities, group games for at least 10 to 15 minutes at a time. So if you notice that your child is either not meeting a variety of the milestones that I just went over, but they're growing and getting older, or they have not yet mastered some of the skills they should have met earlier, or you see other kids their age doing skills that they can't, or it just seems to be like they're missing a lot of things, or they're stuck, like they kind of stuck at around 2 years and now they're almost 5 and they still haven't developed a lot in between 2 to 5, whatever the case may be, your best bet would to be ask the professionals what to do. You can certainly speak to your pediatrician. I highly recommend that. Talk to them about your concerns. Talk to your child's teachers or daycare providers to get some more information, some more guidance, some more advice. Compare notes on skills that they're seeing at school versus what you're seeing at home. That's also important. If there's still concerns, your doctor may encourage you to reach out to a neuropsychologist or a pediatric developmental pediatrician to schedule an evaluation at this point. Please remember, though, that these milestones and their related ages are averages. Some kids develop some skills really, really early, and those same kids may be late bloomers in other areas. Now remember, as their parent, you are the expert on them. So don't panic if you have a 3-year-old, but they don't yet independently join others in play. They might be able to show you they can do that in a month or 2. So just keep an eye on them. And if your child does then receive an evaluation and is given an autism spectrum diagnosis, your evaluator will have really good recommendations on next steps. One that is often provided as a recommendation following this diagnosis is ABA, or Applied Behavior Analysis. It is a proven methodology to help treat the symptoms of autism. ABA, put simply, because most people don't know what it is until they get involved in it, it's just the science of learning. It really is that simple. So ABA therapy would involve meeting with a BCBA, the BCBA would assess your child, look at their strengths, look at their deficit areas and skills they need to work on, and then create an individualized plan for them with goals of skills for them to be taught, and then develop individual programming for each one of those skills based on how your child learns, so that we can teach them the skills that they are not yet able to do and really help them be more successful in their day-to-day life. So we might look at decreasing some behaviors if you're seeing like tantrum behavior or aggression or elopement. If you're seeing difficulty following routines, we can work on those kind of things. We can work on increasing social skills to assist engagement with peers. We work on a lot of communication strategies, because when we see some of those bigger behaviors or inability to do certain skills, a lot of times there's a communication breakdown. So we really work on giving kids the language and whatever methodology works best for them to be able to use language to be effective. We might even work on things like sleeping or potty training. And we also do a lot of parent training as well. So if you're looking for an ABA provider, make sure that you ask around, you interview them, you ask to take a tour of the center. Make sure you're looking for child-led programming with a basis on assent. Ask your BCBA about their personal experience in training. Get as much information as you can, because, as with all other disciplines, you need to make sure that whatever provider you choose is the right fit for your family, not just for your child, but for your whole family. And with ABA therapy, families can and often are involved. We do family treatment guidance, we do parent training. This allows for generalization of skills to home, to school, to anywhere else. So you want to make sure that you're ensuring that the team you choose is the right one for your child and for you. That's it. Thank you so much for joining me to talk a little bit about autism, developmental milestones to look for, and potential next steps. Happy always to answer any questions. Please reach out at any time you can. Contact information can be found below. Thanks so much.